Restless legs. They hit the moment you lie down. That pulling, crawling, deep in the bone feeling that won't let you stay still. And you've been told it's just aging. Or just take magnesium. Or just drink more water before bed. Tonight, I'm going to show you the 3 minerals most seniors overlook in the right order for the right reason. Because the order matters more than any of them alone. And the one most people reach for first? It's not the one that should come first. Not even close. By the end of this, you'll know which mineral sleep specialists actually prioritize before anything else. Why the second one only helps certain seniors. And the one clue that tells you your legs may not be restless at all. For decades, the standard advice for nighttime leg restlessness in older adults has been the same. Take magnesium. Stretch before bed. Maybe it's your circulation. Maybe it's just what happens when you get older. And most seniors nod along, because it sounds reasonable. It sounds like something a doctor would say. However, and this is where the real story begins, the American Academy of Sleep Medicine released updated clinical practice guidelines. And those guidelines do not start with magnesium. They start with iron. Specifically, iron studies, ferritin levels, transferrin saturation. The AASM now includes a good practice statement that iron indices should be tested regularly in anyone with restless legs, and that the serum levels needed for this condition are often higher than what the general population requires. That changes everything, because it means the mineral most seniors buy first at the pharmacy is not the mineral that sleep specialists look at first in the clinic. And that gap between what people try at home and what the evidence actually supports is exactly where restless nights keep repeating. My name is Dr. David Collin, and I need to be clear with you about something before we go any further. This is for educational purposes only. Always discuss changes with your own doctor. What I'm sharing today comes directly from named institutions, published guidelines, and peer-reviewed research. But your body, your medications, your history, that's a conversation only your own physician can have with you. Now, the reason I'm telling you this, the reason I made this video, is because after 60, everything changes, and most people aren't told why. The advice that made sense at 40 doesn't always apply at 68. The supplement that helped your neighbor may not be the right one for you. And the biggest danger isn't picking the wrong mineral. It's never finding out which problem you're actually solving. The enemy here isn't you. It's not your age. It's an outdated, one-size-fits-all belief that every nighttime leg problem in an older adult is the same thing. That it's all restless legs. That it's all magnesium. That if you just relax and take a supplement, the nights will get better. That belief has kept millions of seniors guessing in the dark, literally. So here's what I'm going to do. By the time this conversation is over, you'll understand why your legs won't settle, which mineral deserves your attention first, and what to say to your doctor the next time you sit across from them. If this is the kind of information that helps you understand what your body may be telling you, and I believe it will, subscribe so you don't miss the next one. I cover the things most seniors are never clearly told. Let's start with the mineral almost nobody guesses first. Iron. Not the kind of iron you think about when someone says anemia. Not the iron on your standard blood panel that comes back marked normal. I'm talking about the iron your nervous system needs to function. The iron that feeds a brain chemical called dopamine. Here's what's actually happening. Dopamine helps your brain regulate movement. When you're awake and active, dopamine keeps your legs calm, steady, purposeful. But dopamine production depends on iron, specifically iron availability in the brain. And here's the part most seniors never hear. You can have a perfectly normal hemoglobin level, the number your doctor usually checks, and still have iron that's too low for your nervous system to keep your legs quiet at night. A 2021 updated algorithm published in Mayo Clinic Proceedings made this explicitly clear. The researchers stated that patients with restless legs should have their serum ferritin checked. That's the stored iron. And if it's at or below 75 micrograms per liter, even if nothing else looks abnormal, iron support should be considered. That threshold, 75, is well above the number that would flag most standard lab reports. Think of it this way. Imagine your house has a water tank on the roof. The pipes work, the faucets look fine, but the tank itself is only a quarter full. On most days, you don't notice. But at night, when pressure drops, nothing comes out. That's what's happening with iron and your restless legs. There's enough in your body to look normal on paper, but there's not enough where it matters most, in the brain, at night, when your legs are trying to settle. The National Institute of Neurological Disorders and Stroke, NDNDS, which is part of the NIH, describes restless leg syndrome as a neurological condition, not a muscle problem, not a circulation issue, a nervous system condition tied to dopamine signaling and, in many cases, to low brain iron. They state directly that low levels of iron in the brain may be responsible for RLS. And yet, and this is what makes me angry on your behalf, most routine blood work doesn't include the test that matters. A standard complete blood count checks your hemoglobin. It checks your red blood cells. It does not check ferritin. It does not check transferrin saturation. And those are the numbers the AASM now says should be tested regularly in anyone with this condition. So if you've been told your labs are fine, but your nights keep getting worse, it may not be that your body is fine. It may be that the right question was never asked. Most seniors never connect this to that. Today you will. The slippery slope here is quiet but real. Low iron availability at the brain level affects dopamine. Disrupted dopamine intensifies the urge to move at night. That urge steals sleep. Stolen sleep drains your energy the next morning. Less energy means less walking. Less walking means weaker legs. And weaker legs mean more stiffness, more imbalance, and more risk. That's not theory. That's Tuesday night turning into a harder Wednesday, week after week, without anyone connecting the chain. You know now why this starts. But knowing where it starts is only part of the story. Where it leads, and why the fix most people try doesn't always work. That's what no one ever showed you. Now let me talk about the mineral everyone thinks of first. Magnesium. I need to be honest with you here, because this is where most of the confusion lives. Magnesium is real. It matters. Your body uses it for hundreds of processes: muscle function, nerve signaling, sleep regulation. And if you're low in magnesium, you can absolutely feel it in your legs at night. But here's the part that gets left out. The evidence for magnesium specifically helping true restless leg syndrome is mixed at best. A Cochrane-style review published in 2019 through the National Library of Medicine looked at the available research on magnesium supplementation for RLS and PLMD. That's periodic limb movement disorder, and concluded there was insufficient evidence to determine whether magnesium was effective for restless legs specifically. The Mayo Clinic Proceedings algorithm I mentioned earlier went further. It stated plainly that there is no evidence to support magnesium supplementation for idiopathic RLS. Now wait. Before you throw your magnesium bottle away, don't. Because here's the distinction that changes this conversation entirely. There is a difference between true restless leg syndrome and nighttime leg cramps. And most seniors don't know which one they have. The American Academy of Family Physicians, the AFP, published a clinical review describing the key difference. Restless legs is an urge to move, a crawling, pulling sensation that gets worse at rest, worse in the evening, and improves when you move. It's neurological. Nighttime leg cramps are sudden, painful muscle contractions, usually in the calf, that grab hard and hold. They're muscular. They're different. Magnesium can help when the pattern involves cramping, muscle tension, sleep disruption from tightness, or when there's also constipation or general stiffness involved. That's not restless leg syndrome. That's a cramp overlap pattern. And in that scenario, magnesium may genuinely matter. But if you have the deep, restless, can't keep still, worse at rest feeling, the neurological pattern, and you reach for magnesium expecting it to fix the problem, you may be treating the wrong mechanism entirely. And that's not your fault. It's the fault of advice that never asked you what your symptom actually feels like before handing you a solution. This is not age. This is something your body is doing, and we can fix it, but only if we match the right mineral to the right problem. And that's where most seniors get stuck. They hear legs at night, and they reach for one answer, one bottle, one hope. And when it doesn't work, they assume it's just how aging feels. It's not, and I want you to stop accepting that. Now there's a third mineral that matters, but only in specific situations. Potassium. I'm going to come back to it in a moment, because it connects to something most seniors are never warned about. But first, I need to ask you something. I want you to drop a letter in the comments right now. If you still think nighttime restless legs are mostly a magnesium problem, drop the letter A. If you now think iron status and root cause review have to come first, drop the letter B. I read every single comment personally. Let me know below. And now here's the part I've been building toward. Everything I just told you is real, and it matters. But there's something that changes all of it, something almost no one talks about. And once you understand it, you'll never look at nighttime leg problems the same way again. The real reason restless legs can persist after 60, the real, honest, research-backed reason, is not that your body needs more magnesium. And it's not always even that your iron is low, although that's the most important place to start. The real problem is a matching problem. Your symptom has a mechanism behind it. And if you don't identify that mechanism first, no mineral on earth will fix it consistently. Let me explain what I mean. Some seniors have true RLS, the neurological pattern driven by dopamine signaling and iron availability. Some have nighttime leg cramps, muscular, sharp, tied to electrolyte balance, hydration, and sometimes medication effects. And some, and this is the part that stunned me when I first saw the data, have both, or have a medication that's quietly making everything worse. The Mayo Clinic Proceedings algorithm and the NNDS overview both acknowledge that certain medications can aggravate or even trigger restless leg symptoms. Antidepressants that increase serotonin, SSRIs like fluoxetine, sertraline, paroxetine, antihistamines, the kind in common over-the-counter sleep aids and allergy medications like diphenhydramine, even some anti-nausea drugs. Think about that for a second. A senior takes an antihistamine to help them sleep. That antihistamine can worsen the very leg restlessness that's keeping them awake. Nobody told them. Nobody connected the two. Your doctor never told you this. But I will. Now I want to be very clear here, because we're touching on medication territory. This is for educational purposes only. Always discuss changes with your own doctor. Never stop or change a prescribed medication based on a video. That conversation belongs in your doctor's office, with your full medical history in front of them. What I'm giving you today is the awareness to ask the right questions. And the right questions matter, because the AASM's 2024 updated clinical practice guideline made another statement that changes this landscape. Dopamine agonist medications, pramipexole, ropinirole, rotigotine, which were the gold standard treatment for restless legs for over 20 years, are now conditionally recommended against for most individuals. The reason is a phenomenon called augmentation, where the medication slowly, over months and years, makes the symptoms worse instead of better. So you have seniors who were treated with the best available drug 20 years ago, and that drug may now be contributing to the very problem it was supposed to solve. Meanwhile, the guideline now strongly recommends alpha-2 delta ligand medications like gabapentin and pregabalin, and it places iron evaluation, iron studies, at the foundation of every treatment path. Now bring potassium back into the picture. If a senior is taking a diuretic, a water pill, for blood pressure or fluid retention, that medication can pull potassium and other electrolytes out of the body. A peer-reviewed review published in Age and Aging, the Oxford Journal, found that diuretic therapy is associated with nighttime leg cramps in older adults. Dehydration, low potassium, and electrolyte shifts can produce cramping patterns that look like restless legs but aren't. And if the senior is treating that cramp pattern with iron-focused interventions, or worse, with a medication meant for true neurological RLS, they're solving the wrong puzzle. That's why this is a matching problem. That's why the mechanism matters more than the mineral. I'm telling you this because nobody else in this space will. Most seniors never get this far. They manage one piece of the puzzle, but they miss the matching step. And that gap is exactly what keeps the problem returning night after night, month after month. So here's exactly what to do with everything I've just told you. And I want you to listen carefully to this part, because this is the piece you take with you to your doctor. Step 1 is to identify the pattern. Ask yourself this question tonight. When my legs bother me, is it an urge to move, a crawling, pulling restlessness that improves the moment I get up and walk? If yes, that points toward true restless legs, and the conversation should start with iron studies. Or, is it a sudden calf knotting, a hard cramp that grabs and holds? That's a cramp pattern, and that's where magnesium, hydration, and potassium-rich foods enter the picture. And if you feel sudden pain in one leg, one-sided swelling, heat, color change, or numbness, stop everything. That's not restless legs. That's not a cramp. That's something your doctor needs to see. Today, not next week. Step 2, ask for root cause review. Say these words to your doctor. Can we look at my ferritin and transferrin saturation, not just my CBC? That one sentence can open a door that a standard lab panel leaves shut. The AASM and the Mayo Clinic algorithm both support this as a foundational step. And while you're there, ask about your medication list. Are any of your current prescriptions known to worsen restless legs? That question alone, one sentence, could change your nights. Step 3. Use food-first mineral support in the right order. If the conversation with your doctor points toward low iron availability, that comes first with medical guidance, not blind supplementation, because iron carries real risks when taken incorrectly or when kidneys aren't functioning well. If your pattern is cramp overlap, tension, tightness, cramping, then magnesium-rich foods and adequate hydration become the focus. If you're on a diuretic and your cramps are tied to electrolyte shifts, potassium-rich foods like bananas, sweet potatoes, and leafy greens may help, but potassium also interacts with common blood pressure medications, so that conversation belongs with your doctor too. So to be clear, iron status first, check properly, magnesium second, but only when the cramp overlap pattern fits. Potassium third, in the right context, with medical awareness. That's the order. That's the hierarchy. And that's why guessing never worked, because the order was never explained. The goal after 60 is not to guess a mineral. It's to identify the real reason your legs can't settle and fix that first. Most seniors never connect this to that. Now you have. Think about what this means for tonight. You understand now that your legs at night aren't random. They're sending a signal. And for the first time, you know how to read it. You know which mineral matters most and when. You know the questions to ask. You know what to look for and what to rule out. This is not age. This is something your body is doing, and now you know where to start fixing it. Before I let you go, there's one more thing, and this might be the most important part of everything I've said today. The most dangerous mistake is treating every nighttime leg symptom as a simple magnesium deficiency. Because if the real issue is low iron availability to your nervous system, or a medication trigger, or a one-sided symptom that needs urgent medical attention, no amount of magnesium will fix it. And every night you spend guessing is a night your body falls further behind. Now that you know how to calm nighttime leg unrest, there's something else happening in your body after 60 that can make your legs feel weak, heavy, and unreliable, even if the night symptoms improve. It has everything to do with what your lower body is losing quietly over time. I cover exactly that in the next video. Watch it now.